So larger, fuller bottoms are in, and a Brazilian butt lift is a procedure in which fat is removed from one part of the body and then re-injected into the buttocks. This was a technique that was popularized by our South American colleagues in Brazil, and so hence the term Brazilian butt lift. Typically, a BBL or Brazilian butt lift just involves fat transfers. It's about how much fat do you have and how much larger do you want your bottom. And so I will remove fat a lot of times from the areas around it. So that means the back, the lower back, just starting with liposuction around the buttocks and really kind of creating a curve or changes in the buttocks can actually help make your bottom look bigger just with liposuction. After I remove the fat, we process the fat, we get rid of the extra liquid, then I'll re-inject it into the subcutaneous space of the bottoms. And we use that with long cannulas to help create contour, lift, fill certain defects or certain areas of concavity that patients want adjusted, and then just to give patients an overall fuller bottom. So I'm not injecting fat into the muscle. I'm creating a shape more superficial, so above the fat layer, to inject the fat. After BBL, I tell them it's quite literally a pain in the butt. Your bottom's gonna be swollen, it's gonna feel uncomfortable, and I'm not gonna want you to sit on your bottom directly for 2 weeks. If you sit on your bottom, then you can compress the fat and then you can kind of kill the fat before it has a chance to incorporate into the tissue or really take and be a permanent graft. And so I tell patients you have to think about how you're gonna recover, how are you gonna sit, how are you gonna stand, which position you're gonna be in to help really kind of allow that fat to take and to get the best result possible.